You're watching the Wellness Hour. I'm Randy Alvarez. News that makes you healthier. We're discussing what you need to know if you've been diagnosed with breast cancer. In this particular segment, we're talking to Dr. Laura Lee, and she is a breast surgical oncologist. She is the person you go to right after you've been diagnosed. Is that correct?
Correct.
So welcome back to the program.
Thank you.
Okay, so I guess Angelina Jolie made this very well-known. Women across the country are having double mastectomies all the time. It's a good thing for many of them. They feel great about it. So I don't pretend to know anything really about this. So tell me what women need to know about this. And how do they make that decision in a short period of time?
So Angelina Jolie, and I really appreciate that she was so upfront about what she was going through, because it demystified for a lot of women the experience. But the reality is that less than 10% of breast cancers are due to genetic mutations that are passed from family member to family member. So that for most women, this is not a concern. There are women, or there are certain categories where it would raise the concern about it and that a woman would need to be tested. So if a woman is diagnosed, and she is diagnosed at an age less than 45, that immediately raises a red flag, and she should have genetic testing done. If the woman is less than 60 and has what we call a triple negative breast cancer, so it does not respond to estrogen or progesterone, it does not make a particular protein called the HER2/neu protein, those women should be tested to have genetic testing. If you have a male family member that had breast cancer, that would warrant testing, but in your male family member, and then sort of expand from there. If your family member had breast cancer, like we talked about, less than 45, less than 60, if they perhaps are not alive anymore and therefore can't be tested, you should consider having genetic testing. Even when you've had the genetic testing and find out that you have a gene.
What is the gene called?
So actually, good question, because the ones traditionally that we talk about are the BRCA1 and BRCA2. It is expanding. Over the last 3 or 4 years, the science behind this has exploded. They have expanded. There are other genes that may contribute to you having a higher than normal rate of developing breast cancer. And the issue in these people is they not only develop it at a higher rate, but also at an earlier age, so that it may impact on getting screening, being followed. And the double, I'm happy that you mentioned the double mastectomy, because that's not necessarily always what people have to have. That was a choice that Angelina Jolie made that I respect. If you've been diagnosed with one of these mutations, there's a range of options up to having double mastectomies.
Okay. Now, tell me this. Okay, so let's just say there's a 40-year-old woman. She's into health. She eats at Whole Foods, and she cares about longevity, right? She has kids. She goes, I'm going to order one of these tests just to see. And there must be women, I read an article on the plane, women that are taking the test, perfectly healthy, no indications in their family or whatever, and they are getting a double mastectomy because they have one of those genetic markers.
Right.
What are your thoughts on that? And is that common?
Not common without any family history or anything else that would have prompted.
There are women doing this.
There are women that do it.
So what do you, let's talk to those women for a second.
So insurance does not pay for it. It's an out-of-pocket expense. Now again, as the testing has increased, the price has come down. So probably 3 or 4 years ago, we're talking about $4,000 or $5,000 out of pocket. Now there are some companies where
for the testing.
Okay. There are some companies that will do the full panel of testing for maybe $500. So that's one issue. It's not felt to be beneficial to do it randomly in the population, because the other thing is that if you get a negative result, doesn't mean that you're not at risk for getting breast cancer. And I don't want people to come away from it with that idea. As with regard to the double mastectomies, if you have a genetic mutation, it is a very effective way to reduce your risk of developing breast cancer, or if you've already been diagnosed, of having a second breast cancer. Most of the professional societies, particularly the American Society of Breast Surgeons, are very disturbed that our rate of doing double mastectomies has gone up sharply in the last 5 or 6 years.
Sharply, 10 times more?
Good question. I honestly, off the top of my head, don't remember.
More than double?
I think it's more than doubled from what it previously was. And a lot of these women, they are women that are perfectly good candidates that they could have a lumpectomy and have radiation, or if they did need a mastectomy on the one side, they want to make certain that women understand you don't get a significant reduction in your risk if you don't have a mutation by doing the mastectomy on the other side. I have women that come in, and as long as they understand that, and I've informed them of what the risks, the benefits are, if it's what they choose to do, I am perfectly okay with that, and I will do it. But I always want to make certain that they're really informed as to where the benefit of that is or where it's not.
We have to wrap up the segment, but I have to ask you this question. Maybe every woman knows the answer to this, but if you have been tested, the genetic testing, you have the genetic marker, you get double mastectomy, are you now at what? 2% risk of ever having it?
It's probably
So
2 or 3%. And I'm glad you said that, because that's very important for women to understand, regardless of whether they have the genetic mutation or if they had breast cancer but had a mastectomy, the risk is never zero. It's never zero. And I stress that when patients come in, because I don't want them to go out, not be followed, not examine themselves, because there's still a risk.
Is this something, by the way, that women ask you on every consult? I mean, is this the biggest thing on their mind? Not the biggest thing. They want to know about survivorship, obviously. But is this, they're saying, hey, should I just, do they say, if it were you, what would you do?
Some women, it is, for a lot of women it is, because the reality is whether you're 17 or you're 70, your breasts are part of your personal identity. And so some women surprise me and walk in and say, I want both. I've thought about it before I was diagnosed, and this is what I want. There are some women where it is a very emotionally devastating experience, and so I want to have that conversation with them for them to understand fully what are their reasons behind doing this.
You have to be diplomatic, but are you ever leaning toward the, I don't think it's necessary for you?
I oftentimes will have a patient that if it's not necessary, I don't necessarily advocate it, and if they want to have it done, I try to inform them of what their options are and what the risks are. I'll be honest and say I am fortunate to work in a facility where there is a psychologist that works there with our oncology patients. And I will refer them because there are body image issues and a variety of things that I feel like need to be explored before I'm willing to do it in that situation.
Okay, good. I want to thank you for coming on the program.
Thank
If they
you.
have any questions, they could call you and ask for more. So thanks again for coming on the program. You've been watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.